What's up, Ninja Nerds? In this video today, we're going to be talking about the COVID pill, also known as Molnupiravir. Let's go ahead and get started. All right, Ninja Nerds, so let's get talking about Molnupiravir. Just kind of a basic overview. It is an antiviral agent. It works as a ribonucleoside analog. It's seen to be effective against SARS-CoV-2. Not just SARS-CoV-2, but a bunch of different viruses in general, influenza, MERS virus. And what we know about this drug is that it seems to be particularly helpful in reducing the risk of severe disease in certain populations of patients that we'll talk about, and particularly in more of the mild to moderate cases of COVID, those who are like non-pregnant in general. Let's take a look at kind of an overall statement of this to support what we're talking about on Up to Date. All right, Ninja Nerds, so let's actually take a look at some of the data that we have to back up what we're talking about on the whiteboard. If you guys want to follow along, we're going to be looking at the first component in the Google document down in the description box below. You're kind of just getting an overview about Molnupiravir, particularly from Up to Date. So if you guys look at this here, we have Molnupiravir from Up to Date. They're just kind of supporting what we already talked about. It's an oral antiviral agent. We'll get into a little bit more of its mechanism of action in a little bit, but it works as a nucleoside analog. And there's some evidence that it works against SARS-CoV-2 replication. What kind of SARS-CoV-2? All of the variants, particularly one of the big ones, the Delta variant. Right now, we know that it's being utilized in the UK. It's not yet available in the United States, but Merck is looking to get this drug for particularly emergency use authorization for mild to moderate COVID-19. And this is the big kind of category here, particularly those at risk. So severe disease, mild to moderate COVID-19, and non-pregnant adults. And we'll talk a little bit about this and why. All right, so that covers the first part of Molnupiravir. Let's go back to the whiteboard, talk about the mechanism of action, and then look at the second resource that we're going to be utilizing to back that up. All right, so let's talk about the mechanism of action, particularly of Molnupiravir, the COVID pill. How does this drug actually work? Well, you guys know that we have the SARS-CoV-2 virus, right? And it's responsible for leading to the nasty COVID-19 disease. And one of the particular organs that seems to get really plagued is the lungs. It can lead to acute respiratory distress syndrome. And there's many different types of SARS-CoV-2 variants. The alpha variant, the delta variant, which is the one that was the variant of concern, the big one, as well as the gamma and the mu variant. What we know about the SARS-CoV-2 virus is that particularly utilizes this S protein, the spike protein, to bind to the ACE2 receptors on different tissue cells. We're just using the alveolar cells of the lungs in general, so it tends to be the most plagued organ. Once it hits that cell, binds with those receptors, it uses the receptors to shuttle the virus into the cell. Now, what happens when that virus, or the RNA, which is really the nasty part of the virus, gets inside of the cell? Well, releases its single-stranded RNA into the cell. Once it's inside of the cell, this positive sense single-stranded RNA gets worked on by a very special enzyme here in red, which is this RNA-dependent RNA polymerase enzyme. This RNA-dependent RNA polymerase works to be able to synthesize more RNA molecules. But it has to utilize this positive sense kind of as a template strand, and then it takes all these nucleotides that are present within the cell, the host cell, and add on the complementary base to that. So for example, we know that RNA, A complementary is U, C complementary is G, G complementary is C, and then U complementary is A. So RNA-dependent RNA polymerase will hold the positive sense, use the nucleotide that's complementary paired with that. Now, Molnupiravir, though, is the interesting guy. Imagine it like a mimic of these nucleotides. It's a nucleoside analog, a ribonucleoside analog. And what I really want you to remember is it can act like C or it can act like U at any point in time. So let's pretend for a second here that this was the original sequence of the viral RNA of that SARS-CoV-2 virus. Gets in the cell. Technically, A should go with U. But Molnupiravir can act like U. And so it'll complementary base with that on this negative sense RNA, which is going to be the new strand of RNA that we're trying to make. C, it's going appropriately with G, great. G should go with C, but guess what? Molnupiravir can act like a C, and so it can bind complementary to G, and so there we got these two Molnupiravir analogs. And then we got U, its complementary would be A, and so that binds appropriately. Okay, good. So we have these errors now, kind of like errors, if you will, with inside of this negative sense RNA. Then this negative sense RNA should get made eventually back into a positive sense RNA, which is going to be the progeny. This is going to be the result of this RNA. We want it to look pretty much the same. If we're replicating RNA, we want it to look just like the original. Well, now, this is the Molnupiravir. Now, Molnupiravir, we said originally, with the A's, it should act like U, And with the G's, it should act like a C, which means that it should kind of convert back appropriately. So if it was U, the best situation for the progeny DNA is that it would give you an appropriate A. But guess what? It says, nah, I'm not going to act like U right now. I'm going to act like C. And then C, since it can act like U or C, it says, hey, give me a guanine to bind with. And so it binds with a G. Is the G's different from the A's in this situation? Yes. So this right here is a mutation and a mutation. Okay? Then C, C, those are the exact same. But then let's go to the next part. So here's the next two errors, okay, within the Molnupiravir. Originally, it was acting like a C to bind with the G's. Now, if in a perfect world, these C's should reconvert back into G's. If we utilize these as C's and we take and put on nucleotides, they should act like that and give us G's for both of these, which should be the exact same. They don't in one of the scenarios. So in one of the scenarios, instead of the C acting like a G, and instead of the C complementary binding a G, it says, you know what, I'm going to act like a U for one of them. And so it does this instead for this point here. So you see how this error here, it decides to act like a U. This one, it does do appropriately and act like a C. So since it acts like a C, this one acts like a U, this one will give you an A, and this one will give you a G. So here is another error. So if you look at the points here where it's different, we see that there's an error, error, error in this progeny RNA. This is mutations that we're going to see from different from the original RNA molecule of the virus. Now, if we took this progeny RNA and replicated this one, doing the same thing we just did, imagine how many kind of like mutations that you'll get every single replication cycle. That's the nasty thing about this particular drug, is that every single time you get a mutation in the RNA, you have to replicate it again. You replicate again, you get more viral error catastrophe. More viral errors leads to tons of mutagenesis. And that mutagenesis will eventually lead to the virus's extinction. And that is the basic mechanism of action of Molnupiravir. All right, so we have an idea now of the mechanism of action of Molnupiravir. Let's talk a little bit about the pharmacology, what makes it different from all these other kind of drugs. Well, really, the nice thing about this drug is that it's orally taken, right? So you can take this drug orally. And so therefore, if you can take it orally, it can actually be absorbed across the gastrointestinal tract. And when absorbed across the gastrointestinal tract, then it'll exert its effects on these different types of tissue cells, right? So that's what we know particularly about this drug. Now that's a pretty cool benefit. And one of the reasons why this may be a cool benefit of the COVID pill is that it's an alternative. You know, monoclonal antibodies, they kind of can act somewhat similar to these in different types of antiviral drugs. So these kind of, some of them run through IV infusions, or they have to be given via some type of IV or injection type of way. Well, these can be oral, and so that's kind of an ease of access when it comes down to it, right? One of the nice kind of pharmacokinetic aspects of this drug is that it has a half-life of 7 hours. In comparison to some of the other ones, like one other drug that we may talk about in the future called ivermectin has a half-life of like 81 to 91 hours. So the half-life is kind of nice for this drug, which means since it's kind of like 7-hour half-life, we have to take it about twice a day to get kind of that therapeutic concentration of it. And so what we've seen is the dosing, particularly for this drug, is anywhere from 400 to 800 milligrams, particularly twice a day for about 5 days seems to be the dosing regimen. One of the interesting things, and we'll see if this changes a little bit, is that it's a kind of expensive pill, okay? So $70 for one pill, and you take twice a day for 5 days, a total about 10 pills, so about $700 for a course of this type of, particularly this medication, the COVID pill. All right, so let's look at the second article down in the description box below. Again, go check that out. It's in a Google Doc. We're going to kind of overview, kind of look at what we have in our data to support the mechanism of action of Molnupiravir. So this was an interesting kind of article from the Austin Journal of Pharmacology and Therapeutics. And again, the whole purpose of this was kind of a mini review of drugs that have been shown, particularly oral drugs that inhibit SARS-CoV-2 and COVID-19. And it's really comparing Molnupiravir and ivermectin, but we can utilize this particularly. So let's come down here. We're going to talk a little bit about the mechanism of action. I like this table. I think it gives a nice little kind of overview. And we already kind of talked a little bit about how Molnupiravir is a ribonucleoside analog. So it can kind of act like cytidine or it can act like uridine. And so it can play a role within that complementary base pairing that alters the activity of the RNA-dependent RNA polymerase. Well, how exactly does this ribonucleoside work again? Well, we have here the evidence that shows that it acts kind of like a substrate for that RNA-dependent RNA polymerase, and it incorporates the molnupiravir into the viral genome. Problem is, though, is when you incorporate that in, it leads to lots of mutation errors. And then as you get more and more mutations, it leads to this viral error catastrophe, and eventually the viral becomes extinct. And this whole big thing here is called viral mutagenesis. So that's kind of the big thing that we see here with respect to the mechanism of action of molnupiravir. Okay, now when we talk about the next aspect that we also talked about on the whiteboard, which was the pharmacology. The pharmacology, particularly like the pharmacokinetics, the pharmacodynamics, we can also get a lot of information about this drug. We said that it's one of the oral antiviral drugs. And one of the cool things is that this drug has been used in multiple different types of viruses that we've studied it in. It's worked in MERS. You can actually see it's particularly, we've actually been able to use this in SARS-CoV-2, the pandemic influenza, the MERS coronavirus. But one of the cool things that we know about this drug in comparison to your monoclonal antibodies is that it's oral. So you can actually take this as a pill. Its half-life is about 7 hours, which is pretty good. And then the other thing is we have a dosing regimen that's been shown to be relatively effective, which is giving it twice daily. And usually the doses is anywhere from 400 to 800 milligrams. And what we've seen with this is that it was able to show some viral clearance by the RT-PCR, the nasal swab testing. So we know it's oral, half-life is 7 hours. And then again, we have the dosing range. And then again, we can come down here and we have some more evidence to kind of support that. Here's our half-life. Here's the amount of dosage, 400, 800 milligrams. And again, it's oral, and we have an idea now of the evidence to support what we're talking about on the whiteboard. All right, so now that we've done that, we know the mechanism of action, we have an overview kind of concept of it, the pharmacokinetics, pharmacodynamics. Let's get back to the whiteboard and start talking about the studies that showed some efficacy of this drug. All right? All right, so let's talk about the population targeted. Who is the particular people that molnupiravir, the COVID pill, would be best for? And so what the studies that we'll talk about in a little bit looked at is that this seems to be best in patients who are more of the high-risk category. And what are these high-risk categories particularly meaning? So people that are greater than or equal to 60 years of age, we've seen higher mortality rates associated with that age range, and those who've been infected with SARS-CoV-2 virus or developed COVID. Obesity, so high BMI, heart disease, particularly hypertension, and then diabetes, as well as on the lower end, those in immunocompromised state, whether that be because you have cancer, whether it be because you have HIV, whether that be because you're on some type of immunosuppressive medication in general. These tend to be the populations that are most particularly affected and at high risk of severe diseases of COVID, okay? Now, the other area that we are particularly, and we'll talk a little bit about this as to why maybe this is, we still need some more literature to kind of back this up, but we also particularly try to make sure that the patients that are targeted for this particular drug be not pregnant. Why? Is there a risk of birth defects, abnormalities? I think it's too early in the studies to be able to say. We might need some more long-term literature, but those that are non-pregnant, so obese, greater than 60, heart disease, diabetes, immunocompromised, non-pregnant, and the next thing is mild to moderate COVID-19. There's a bunch of different symptoms of COVID, but generally these are going to be the patients that are not hospitalized that seem to be the most beneficial target for this drug. So mild to moderate COVID-19, generally in an outpatient setting, and they've had symptoms, this is a key thing, for less than 5 days. The nice thing about this is that we've seen literature where this can be effective against all the SARS-CoV-2 variants, Delta being the most ominous type of one. All right, so let's talk a little bit about the efficacy of this drug. So we have particularly like one study, and it looked at about 700 odd patients, and we have to have a very specific inclusion criteria. So particularly that we were looking at. So those obese, greater than or equal to 60 years of age, had a history of heart disease, diabetes, immunocompromised, all the things that we talked about before, that seems to be the area of most high risk for those that could get severe COVID disease. So again, these are the actual criteria that we were looking for: obese, greater than 60, heart disease, diabetes, immunocompromised. The exclusion criteria is we didn't want anybody who was pregnant, okay? And we had about 700 odd patients. We randomized those patients into two particular groups. One is the molnupiravir group, that's the COVID pill, and then the other placebo group. Now, once we did that, we looked at the study over a very specific period of time. And this study was actually stopped early because of the efficacy, that it seemed to be such a significant difference in reduction in hospitalization and death associated with utilizing molnupiravir, actually in comparison to the placebo, that the study was actually stopped early. And what we saw out of this study is when you compared molnupiravir to the placebo group with respect to deaths with the molnupiravir group was 0 in comparison to the placebo, 8. Hospitalization was the big difference here, which is kind of a marker of mortality, severe kind of cases. It seemed to be 28 patients in comparison to 53. So that's about a 7.3% out of this study and about 14.1% out of the placebo study. So if you look at the actual reduction in hospitalization compared molnupiravir in the placebo group, it's about a 50% reduction. And the p-value is about 0.0012. That's a significant difference when you're comparing these two. Adverse effects wise, whether this be due to COVID, whether this be actually due to the drug, we didn't particularly look at that, was adverse effects for the molnupiravir group was 35%, and then specifically for the placebo group was 40%. But when you look at those adverse effects and what do we think that was related to the actual drug, 12% of that maybe was actually related to the molnupiravir for the adverse effects, whereas 11% was for the placebo group. And then the last question is, how many people actually discontinued molnupiravir because of the adverse effects related to the drug? And it seemed to be about 1.3% in comparison to the placebo, which is about 3.4%. So it seems to have very little side effects related with the drug as well. So we can see a very significant difference when comparing molnupiravir to the placebo group. Now again, let's take a look at some of the literature. It's not RCTs, it's actually a press release interim analysis in phase 3, but let's take a look at it and see a little bit more about this study. All right, so we saw what we talked about on the whiteboard about the efficacy, the study that was involved, particularly, and again, it was not an RCT. It was this is a press release that was released by Merck. And it shows kind of the study that they performed on particularly the molnupiravir and the overall kind of results of the study. And we already know that it seems to be pretty effective at reducing the risk of hospitalization or death by approximately 50% compared to the placebo in mild to moderate COVID. And again, we can see that here as we kind of look at this abstract portion here. We say that the interim analysis, they stopped the study early because of how effective it was. It reduced the risk of hospitalization or death by approximately 50% in comparison to the placebo. And then the other thing is we want to know our p-value. Look at that p-value. That's a very, very significant difference within the p-value. So that's kind of just going to show the efficacy of this drug. All right, so now that we've covered that, now let us move into the next part of our discussion, which is there any things that we have to be worried about, safety concerns like oncogenesis or any kind of other things like cytotoxicity? Let's talk about that on the whiteboard. All right, so we left off talking a little bit about some of the adverse effects that we were maybe a little concerned with taking a drug. I think everybody should have that. You should wonder, what are some potential bad things that could happen if I do take this drug? Yeah, it seems to be effective at reducing hospitalization, death associated with COVID-19, but is there anything that I should be scared of, watching out for, I should probably think about before taking this medication? And that's always a good question. And so some of the safety concerns, particularly, again, there's no kind of like RCT evidence, and there doesn't seem to be kind of anything that really supports this claim, but some of the experts, particularly like experts in biochemistry, pharmacology, virology, think that what if there is any concern of oncogenesis? Because molnupiravir is a nucleoside analog, could it actually get incorporated into some of the actual host cells' DNA, like a precursor DNA? And then if that precursor DNA goes and replicates, it can produce mutagenesis, and those mutations within our host cells' DNA can then lead to oncogenesis, formation of cancers, or if this is actually in somebody who's pregnant or some type of child, could this produce some type of birth-related defects or pregnancy-related certain types of negative outcomes? And so that was the question, is there a risk of oncogenesis as well as birth types of abnormalities? So there was a statement from Merck, and they said that they denied that there was any kind of particular evidence. So there was a virology expert, and we'll look at that actual report, but they denied any kind of evidence of oncogenesis. But in there, they do claim you should try to avoid those patients who are pregnant And if they are within childbearing age, they should try to abstain from sex for a certain 28-day period, or try to utilize contraception during that time period. And I think that's a good blanket statement in general. Any kind of like study where you're testing a drug, you should try to reduce any risk of teratogenic effects in general. So that's what we know about the questionable concern of oncogenesis associated with molnupiravir. Let's take a look at the cytotoxicity effect. So when we talk about this, what is this concern of cytotoxicity? The question is if I take this drug, and yes, it should help to kill those cells that have been infected by the SARS-CoV-2 virus. But what if it doesn't just target these cells? What if it targets some of my other healthy, normal cells that I want to keep intact and I don't want them to go and die or develop mutations or DNA damage? How do I know that this isn't going to damage my own healthy cells? And so that's the question. Can this destroy all of the cells, not just the infected ones, but the non-infected healthy cells? And so what they did is there was a study that they did on animals. They took some tracheobronchial tissue cells from some mice. We call these the Calu-3 cells. They took those cells, washed them, infected them with the SARS-CoV-2 virus, and then introduced the particular type of molnupiravir to see what the concentration that was necessary to be able to produce a decrease in the virus activity or the viral titers. And then we also said, okay, what's the concentration that I would need this drug to get to be able to produce a general cytotoxic effect on all cells? And they did the same exact study with Vero cells. So these are basically African green monkey cells from the kidney. They took that, washed them, infected them with the virus, gave them the drug, and then see what is the concentration necessary to reduce the viral replication, but what is the maximum concentration that I would have to reach to cause damage to all multiple cells. And so what did they see within the study? Well, the concentration that you would need of the molnupiravir to be able to reduce the SARS-CoV-2 activity by half, the IC50, was 0.8 micromolars. And then for the African green monkey cells, it was 0.3 micromolars. Guess what the cytotoxic concentration that you would need to be able to reach in order to cause multiple cellular damage, not just the virus-infected cells? You would have to get up to about 10 micromolars. So you could see that it's nowhere near the cytotoxic concentration to be able to produce damage to multiple different tissue cells. So it seems to be relatively safe. And then also in this same article, they went on to compare a little bit about remdesivir, which is an antiviral drug that we utilize, particularly in the treatment of COVID and hospitalized patients. It seems to be, in this article, in animal studies, it may be superior to remdesivir. Okay, especially in having lower concentrations. You actually could have a lower concentration of the drug and have a superior antiviral profile. And what we think is that maybe remdesivir is not as good in those resistant cases that may be having, where the virus is maybe developing a resistance to the remdesivir. This may be a good opportunity to trial something like molnupiravir or, again, the COVID pill. Let's take a look at some data that helps to be able to support these claims of questionable safety concerns with respect to oncogenesis and cytotoxicity. All right, so we talked a little bit about some of the safety concerns, particularly is there a concern for oncogenesis on the whiteboard? So when we talked about this, here's kind of the article that was published here. And again, it was an article that kind of took from experts. Again, this isn't kind of like any published data, so just take this with a grain of salt. But there was particular kind of like virologists and kind of biochemistry experts. One of them was, his name was Ron Swanstrom, and he's a professor at the University of North Carolina, Chapel Hill, and he was concerned about, there was a question, can molnupiravir be metabolized into some type of precursor of DNA, get incorporated into the DNAs of the host cell nucleus, and then lead to oncogenesis via mutagenesis within our normal host cells. And because in theory, mutagenic drugs can cause birth defects, can cause cancer like we talked about. And that's why sometimes you'll see that whenever we looked at the study particularly was kind of excluding any females that were pregnant. And if they were going to be involved in this kind of study or take the medications, they had to have contraceptive methods or actually remain abstinent for a certain period of time while on that drug. And so again, there is some type of question of that. However, Merck didn't kind of immediately respond to the request for a comment, but in a conference call, they said, particularly from Daria Hazuda, one of the virologists, said that, again, there is no evidence of the potential for mutagenicity for this agent. She concluded that the company is very comfortable that the drug will be safe if used as intended. And again, I think when it comes down to the FDA utilizing this, they wouldn't pass something that it was having any kind of mutagenic potential. So that's kind of what we have on the particular safety concerns. Now let's talk about the next part. And again, remember, this is within the description box. This was 5A. The next one that we're going to talk about that we discussed on the whiteboard was particularly, is there any cytotoxic effects? So not only can this cause oncogenesis, tumors, birth defects, but can it kill our healthy cells rather than targeting the viral infected cells by the SARS-CoV-2 virus? Let's go ahead and take a look at that article, 5B. All right, so let's take a look here at 5B. This was the kind of going into talking about, is there any kind of cytotoxic effects that we have to worry about with this drug, Molnupiravir? Can it target viral infected cells and not some of our healthy normal cells that are not infected? And that's kind of the concern. Can it damage our cells? Can it have injury on those healthy cells within our body? And so this was a study that looked at that drug, particularly in particular cells, human airway epithelial cells from mice, and then they also looked at some African green monkey cells, particularly from the kidney. And what they did is whenever they kind of looked at this study, they found that there's a very specific concentration that if you get to this concentration with Molnupiravir, it has the ability to have cytotoxic, DNA damaging types of effects and damage healthy cells besides the viral infected cells. And what they observed that concentration to be is that this concentration, particularly the cytotoxic concentration, the CC50, had to be at least greater than or equal to 10 micromole. And so that's the concentration that we have to try to avoid getting up to. All right. So what we're going to do is we're going to take a look at this figure. We're kind of going to blow it up and see what this drug concentration was that it was able to have an inhibition of SARS-CoV-2, but without reaching that actual cytotoxic concentration. So let's take a look and zoom in here on figure 1. All right, so we're taking a look here at this figure 1 within that article, again, 5B. And what we see here is this is called the Vero cells. This was the African green monkey kidney cells that we took from those cells and then actually infected them with the SARS-CoV-2 virus and then gave them this Molnupiravir to see what their IC50 was. Basically, what's the concentration of the drug that's needed to be able to inhibit the biological process, the infection and replication of SARS-CoV-2 by half. And so we see that the IC50 is nowhere near the CC50. So it's around 0.3 micromolars. That's nowhere near 10 micromolars. So that's a pretty significant difference. And so NHC is basically kind of the scientific name for the Molnupiravir, if you're kind of worrying about that. All right, so we see that it's relatively effective. It's able to reduce the viral replication, the effect of SARS-CoV-2 in the Vero cells without reaching that cytotoxic concentration. And if we come down to the next one, which is looking at the percent inhibition of the SARS-CoV-2 in Calu-3 cells, this was those tracheobronchial cells of the mice. We're actually infecting those cells and then giving the drug to see what the concentration is that can reduce the biological process of that virus by half. And so its IC50 is 0.08. Again, nowhere near the cytotoxic concentration of 10 micromolar or greater. And so we see that this drug has a very low concentration needed to be able to produce the destruction of the viral cells without getting to the concentration that's needed to be able to harm our normal healthy cells within the body. And so that's a pretty cool kind of figure here. Again, do take into consideration this is animal studies. We'd need more particular types of studies a little bit further to kind of look and see how this works, particularly within human cells. But at least we have an idea here. Now, let's talk about the next figure, figure 5, that kind of just takes a little bit of a deeper dive comparing remdesivir to Molnupiravir, okay? Let's talk about that in figure 5. All right, so here we have our figure 5 within, again, that article in 5B. And what we're looking at here is we're looking at the infectious virus production, basically the viral activity. Okay, so how much the virus is, like the concentration of that virus is, particularly viral titers here on the y-axis. and then basically the number of hours post-infection on the x-axis. And then we're looking at three particular things. We're looking at the vehicle, the thing that needs to, basically transport the remdesivir or the molnupiravir into the particular host cells. And then we're looking at remdesivir, and then we're looking particularly at the molnupiravir. And what we're looking at is on here, you see there's these different color-coded boxes here. This is the concentration of the drug that we're delivering, right? Or the concentration that's needed to be able to produce that kind of antiviral activity. Don't look at the 10 micromoles and don't even really focus too much on the 1 micromoles. Let's look here at the low concentration here of remdesivir and the low concentration here of molnupiravir. At 0.1 micromolar of remdesivir, look at the viral activity on the y-axis. It still has a lot of viral activity still at that kind of like low concentration. So at a low concentration of remdesivir, you still have, again, follow this over to the y-axis, a pretty high viral titers. Now, it's not like out of this world, but look over here at molnupiravir. It's not like a crazy difference, but if you're looking here at these boxes, the 0.1 micromolar here in pink, look at this one, the highest one here. It's much lower than the remdesivir. So at a low concentration of molnupiravir, you have more antiviral activity, less viral titers in comparison to remdesivir. So what this study was able to show was that particularly molnupiravir may have more efficacy than remdesivir at SARS-CoV-2. And in those cases where remdesivir, particularly the SARS-CoV-2 viral variants and all the different types of effects that those have at being resistant to remdesivir, molnupiravir may be an alternative option to those remdesivir resistant cases in SARS-CoV-2 variants, okay? So we see that effect here. Now the other thing, I just kind of want to clue your eye towards it. The article does talk about it a little bit, but it's talking about the total error rate. And this goes back to that mechanism of action that we talked about with particularly the molnupiravir. We know it works by inducing this viral mutagenesis, producing tons and tons of errors within the single-stranded RNA molecules. And that leads to different changes within the viral proteins. Well, here, if you look at this, it looks at the total error rate as we go up the y-axis and then time on the x-axis. And then you have the concentrations. Well, what we're noticing here is that with even low or higher concentrations of this molnupiravir, it produces a ton of errors within the viral RNA of SARS-CoV-2. And then if you look at remdesivir, no matter what the concentration is, it produces very little errors within the viral RNA of the SARS-CoV-2 virus. Now, these two have completely different mechanism of action, though. So in some ways, this kind of comparison isn't a great comparison for this type of graphic representation. And I think that's important to realize. This drug, molnupiravir, induces viral mutagenesis. Remdesivir just works to inhibit the dependent RNA polymerase from being able to form new RNA molecules. So again, complete different mechanism of action. So I just take this with a grain of salt, this particular type of figure here. But again, I think the overall thing to take away from this particular last article 5B is that we see that there's very low risk of cytotoxic effects with these drugs, particularly molnupiravir, and it has a good efficacy at low concentrations, and it also seems that it may be better than remdesivir, particularly efficacy-wise, and good at being able to help in those remdesivir-resistant SARS-CoV-2 cases. All right, that covers all of this data here. All right, engineers, so in this video, we talk about molnupiravir, which is the COVID pill. I hope it made sense. I hope that you guys enjoyed it, and I hope it really helped to clear up some questions that you might have. If you guys like this video, continue to support us by hitting that like button, commenting down in the comment section, and please subscribe. All right, engineers, as always, until next time.